Good afternoon. I'm Mayor Leary Gaylord-Baird, and welcome to this community briefing. Joining us once again to provide interpretation is Margie Propp. Thank you so much, Margie, for being here. And thanks to all of you for tuning in to learn more about the latest local developments and how you can keep yourself and your loved ones safe. So about a year ago this week, on March 6, 2020 to be exact, the first case of the novel coronavirus was confirmed in Nebraska. And around that time, the girls' state high school basketball tournament went on as planned, but our situation changed quickly, and the boys' tournament the following week saw its attendance limited to immediate family members only. And that week last year marked for many of us the point in time when the pandemic first felt real. The very next day, after the Nebraska State Activities Association, or NSAA, made its announcement about changes to the boys' tournament, the NCAA announced that they too would be making changes. The NBA followed suit, and the word bubble took on a whole new meaning for us. Fast forward to this year's state high school basketball tournaments, and the progress we've made as a community is palpable. And as I toured the Pinnacle Bank Arena yesterday, I felt so proud of Lincoln's efforts to safely hold the tournaments and welcome fans once again to the capital city. Our community is fired up, and PBA is ready for about 60 games over the next 2 weeks, with 5,000 seats available for every game. To protect spectators, every other row of seats is blocked off, seating will be available in groups of 8, and the venue will be thoroughly cleaned after each game. And with these safety precautions in place, we are thrilled to be able to welcome fans back to this signature event for our community. The NSAA has worked closely and tirelessly with our health department on the tournaments, and today we are happy to welcome Jay Beller, the NSAA Executive Director. Thank you so much for joining us today, Jay.
Thank you. Thank you, Mayor. Yes, quite a difference down at Pinnacle Bank I just came from, and fans having fun. We have 3 games in the books already, 57 more to go, and we're excited about that. We still have work to do, and we understand that. We've worked closely with a lot of different organizations to make this go, and we're excited to where we are today. I really didn't have an idea of last year when I was called to the offices here on what was going to go on, but limited attendance, canceled games, contact tracing, things I didn't know much about at that point in time, and so over the year we've learned a lot. Going through this year, I find that Nebraskans are truly resilient, and I want to personally thank each and every one of the sacrifices you have made. From the NSA standpoint, we pulled together and made it work for our kids, giving them opportunities to participate. And when I say that, I was on a Zoom call with the other states across the United States, and of course we're one of 51, and there was 8 states that as a month ago, for 8 months, haven't been doing anything. And so with the efforts of a lot of people, we were able to give our kids the right to participate, and they thoroughly enjoyed that. I'd like to, at this time, thank Mayor Gaylord-Baird and her staff, Governor Ricketts and his staff, Pat Lopez and her staff, Lincoln Public Schools, Steve Joel and Kathy Wieskamp and their staffs, and even Tom Lorenz at Pinnacle Bank, Jeff Mall at the Lincoln Convention and Visitors Bureau, for making the next couple weeks possible and hopefully very successful. These groups, we've learned to work together. Maybe we met with circumstances that were beyond our control, but I think that when we work together, a lot of good things can happen. Once again, I go back to our kids and our parents are blessed to be in a state where people will roll up their sleeves. They'll work hard at doing the best for our kids, and we sure appreciate that. There's a lot of games to go on. The weather is beautiful. The hotels and the restaurants are waiting for everybody, so please come out and join us the next 4 or 5 days of this week for girls, and 5 days next week for boys. We had to make our tournaments a little bit longer because of some of the things we did to get more people in to see the games, but so far everybody's been really positive, and it's going well. So thank you very much once again, Mayor, for the opportunity, and thanks to everybody in Lincoln for doing what they're doing, because our end game way back when we start these seasons is let's do whatever we can so the boys and girls can have their tournament games played later that season, and we've been able to do that. So thank you very much.
Thank you, Jay. Lincoln is so excited to welcome young athletes from all across Nebraska, and we're grateful to you for your steady leadership in these times. And our excitement and optimism grows each day as we head into spring. Local COVID-19 case numbers and hospitalizations have leveled off, and our nation now has 3 safe and effective vaccines, doses of hope that every day lead us on a pathway forward out of the pandemic. And I'm so pleased to announce that we just learned today that the Lincoln-Lancaster County Health Department has received its first shipment of Johnson & Johnson vaccine. Here with more on this breaking news and on our progress in this pandemic is Health Director Pat Lopez.
Thank you, Mayor. Yes, we can now see brighter days ahead, and our ongoing vaccination efforts are playing a big role. A third vaccine that offers protection against COVID-19, the Johnson & Johnson vaccine, or Johansen, as you'll also hear it said that way, and it looks like Jensen, but that is the Johnson & Johnson vaccine you've been hearing about, has just received emergency use authorization. Doses started shipping yesterday, and state officials reported that Nebraska ordered 15,000 doses of the vaccine this week. We received 3,000 doses this morning at our health department, and we're in the process of incorporating them into our vaccine efforts. The Johnson & Johnson vaccine has 2 major advantages over the first 2 vaccines. It's the first single-dose COVID-19 vaccine, and it's stored at regular refrigerated temperature, making it more flexible and easier to transport and store. The FDA approved the vaccine Friday, and the CDC's Advisory Committee on Immunization Practices recommended the vaccine for use in people age 18 and over on Sunday. A third safe and effective vaccine is a welcome addition to our vaccine arsenal, and it's expected to help scale up supply nationwide. COVID-19 vaccine provides protection against the virus, prevents illness, and saves lives. We continue to encourage people to get vaccinated with the first vaccine that's available to them. Our health department, along with our partners, Bryan Health, CHI St. Elizabeth, Lincoln Surgical Hospital, and Blue Stem Health, as well as the long-term care facilities, have now administered more than 81,000 doses of vaccine. 52,000 of those doses were first doses, and around 29,000 are second doses. More than 7,900 residents were vaccinated at 3 large-scale vaccination clinics at Pinnacle Bank Arena last week. On Wednesday, we vaccinated 2,700 residents, mostly those age 71 and older, and their spouses. On Thursday and Friday, we administered about 5,200 second doses to residents age 80 and older. And we really want to say thank you again to the arena staff, our partners, volunteers, and the health department team for their ongoing commitment to providing vaccine to people in our community. Last week, we also largely completed vaccinating homeless shelter staff and corrections staff who are next on the state's priority list for essential workers. And we worked with Lincoln Surgical Hospital and physicians to hold a vaccination clinic for patients who are receiving cancer treatment. This week, we will be receiving close to 8,200 doses of Pfizer and Moderna vaccine, our highest allocation to date. With the additional Johnson & Johnson vaccine, we will have about a little over 11,000 doses to administer this week. Our vaccination efforts will include additional people in Phase 1B who are now eligible to receive vaccine, as well as others who are scheduled to have second doses. The arena continues to be an excellent venue for our vaccination clinics, but we are fortunate to have other venues that meet our specification. As you heard, we have the high school state basketball tournament going on. And why that's happening, with the coaches and fans there at the arena, we will be holding 3 large-scale vaccination clinics at Speedway Village. The first clinic on Wednesday is for Lancaster County residents age 70 and older and their spouses. We've contacted those individuals in that age group and who are registered to receive the vaccine and asked them to schedule their appointments. People will need an appointment to get vaccinated, and there will be enough vaccine for everyone who has an appointment. The other 2 clinics on Thursday and Friday are second dose clinics for residents age 75 and older. Individuals in this group are also currently being notified of their appointment times. The health department will be working with various partners and volunteers to provide extra support and assistance to help ensure accessibility and mobility for the population being served. Next on the state's priority list for essential workers are educators. And we will have a clinic on Saturday at the Center for People in Need for educators age 61 and older, and those who work with students who aren't able to wear masks. These individuals are currently registering for their appointments. We are also partnering with Bryan Health to hold a clinic this week for individuals who have serious health conditions who need their second dose of vaccine, and additional individuals with serious health conditions. We are working with physicians to identify those residents. We have a vaccine information page on our website at covid19.lincoln.ne.gov. This includes a list of the priority groups in each phase and who is currently being vaccinated. We want to remind you that the first step toward getting your vaccine is getting registered with the secure online covid19.lincoln.ne.gov website. The form is available in English and Spanish. As doses become more available, those who are registered will be contacted to schedule an appointment to get vaccinated. Registration is open to all county residents. Those who do not have online access or need assistance may call the COVID-19 hotline at 402-441-8006 to register. Our health department also has interpreters available to assist callers who speak other languages. We continue to enhance our clinic process so getting vaccinated is as safe and smooth as possible. We were happy to welcome the governor last week at one of our clinics, and he called in an impressive operation. He visited with some of those receiving vaccinations who shared their positive experiences. He also got a firsthand look at some new technology. We have launched an electronic automated system that simplifies the check-in process. It's basically paperless and allows us to track vaccinations at the clinic in real time. Tablets are now used as part of the check-in process, and laptops at vaccine stations allow vaccine information to be entered electronically. Completed vaccinations will show up instantly. The new system is efficient and eliminates the need for additional data entry. Our local vaccination information is updated into the state's immunization information system. Our city technology team was instrumental in implementing these processes. Joining us is David Young, the city's Chief Information Officer, to talk about the latest developments.
Thank you, Pat. I appreciate the opportunity to come in and speak. Well, we've done a few things, learning in this process, starting out with paper, making sure that the vaccines were deployed, and then embedding some IT professionals in the process so that they could learn from nurses, from volunteers, exactly how it was working and get that real-world experience before we built our electronic application. It all starts if you go to the City of Lincoln's website or Lancaster County's website and click on the link, Register Now. Once you register, your information is stored in a secure system, and then the health department professionals will add you to a call-out list for a given number of clinics in a week. So you get a link that says, or a phone call that says, select your date. When do you want to come in and sign up for your time to come in and get your shot? I think it's very important that when you look at the information that we're asking for online, it only takes about a minute to sign up. It's a very short amount of information. That information is held securely, and then once you get your vaccine, that information is provided to the state, all electronically. So we are excited to be a part of this process, really honored that Pat and her team gave us the opportunity to come in and learn in the beginning, starting with paper and then building this application. Thank you.
David, I want to again thank you for your work on this important process. We are really pleased with these technology improvements. This is another great example of how many city departments and divisions are part of our effort to keep our community safe and protected. And as we work to get vaccine into the arms of more Lancaster County residents, it's also imperative that we continue to take preventative action. One of the reasons is that the virus is constantly changing, forming what we call variants. On Saturday, we confirmed that the state has identified 13 cases of a variant in Nebraska, including one in Lancaster County. The variant strain is called B1.429, also known as the California variant. It was identified through special testing at the Nebraska Public Health Lab, and the local case was identified as a man in his 60s, and we are continuing our current investigation. Again, this is not unexpected. Just 2 weeks ago, Dr. James Lawler from UNMC was part of this briefing to share information about the variants and the safety and effectiveness of the vaccines. If you missed Dr. Lawler's remarks, you can find them on the Lincoln Lancaster County Health Department Facebook page. Less is known about the California variant than the other variants, but is likely more easily transmitted. Since variants can spread more easily and quickly, they may lead to more cases of COVID-19. Data so far suggests the current vaccine should still provide protection against variants, although that research is ongoing. Scientists are studying the variants, and new information on variants is emerging rapidly. We will continue to closely monitor the situation, and as new information becomes available, determine the potential impact on our community. It is very likely that we will see more local cases related to variants, and that reminds us of the need to remain cautious. It is critical that we continue to take preventative actions that have been proven to slow the spread of COVID-19. Wear a mask, watch your distance, and stay at least 6 foot away from others. Wash your hands, stay at home if you're sick, avoid those crowded places, close contacts, and confined spaces. Get vaccinated as soon as COVID-19 vaccine is available to you. Now I'd like to turn to our COVID-19 risk dial. Most of the indicators that we use to determine the position of the dial leveled off in February. For that reason, the dial will remain in mid-yellow for the 3rd consecutive week. The 7-day rolling average of new daily cases shows cases fluctuating between 44 and 52 through much of February. We now have seen fewer than 350 weekly cases for 3 straight weeks. For the week ending February 27th, we now have just 338 new cases. And our number of tests completed continues to be low, with just over 1,500 tests completed this week ending February 27th. And the number of COVID-19 patients hospitalized locally declined in January and early February, but now has leveled off. Since February 11th, we have fluctuated between 27 and 40 COVID-19 patients hospitalized daily. Today, we are reporting 40 hospitalized, with 25 of those community members from Lancaster County and 15 others from different communities. Finally, today, we have made some enhancements to our dashboard to provide the public with more information on vaccinations. Tommy George, one of our public health epidemiologists, is with us to show the changes.
Good afternoon. I want to start by thanking our geospatial services team for their work on these enhancements. We've added total vaccinations, first dose vaccinations, and second dose vaccinations to this dashboard to provide a general understanding of how many vaccinations we've provided to date. Currently, we've administered over 80,000 vaccinations, including over 52,000 first doses and nearly 29,000 who have completed the vaccination series. This chart shows the population percentages by race and ethnicity based on the most recent available census data in comparison to the percentage of all people vaccinated in each racial and ethnic group. The yellow bars are the percentage of those vaccinated who are in that group, while the blue bars are the percentage of the population in each group. The health department is using these data to inform our targeted outreach about vaccine safety and efficacy. The next chart shows the population percentages by age group based on the most recent census data in comparison to the percentage of all people vaccinated in each age group. Thanks to our community's efforts to vaccinate those aged 65 and over, we see a large percentage of those vaccinated are 65 years and above. The main reason why there is still a large percentage in younger age groups is due to the vaccinations of healthcare workers in Phase 1A and other eligible populations in Phase 1B. The next two charts show the number of weekly doses. One chart shows the number administered by week, while another shows the cumulative number or the total number of vaccinations administered to date. This helps us understand how many vaccinations have been administered in our community over time. And the following charts show the number of weekly first doses and the number of individuals who have completed their vaccinations. Right now, it reflects the number who have completed the 2-dose Pfizer and Moderna series. In the future, though, it'll also show how many have received the single-dose Johnson & Johnson vaccine. These charts help us understand how many people have started to be vaccinated and how many have completed their vaccinations. Thank you.
Thank you, Tommy. We'll open up for questions today, and I just wanted to thank our guests, Jay Beller and David Young, again, for being with us here today. So do we have questions from the media?
Director Lopez Riley with the Journal-Star.
Hi, Riley.
Hi. Could you talk a little bit about how does the health department decide which vaccine to administer at what clinic, and how does the Johnson & Johnson arrival, how does that factor into where and what population will receive it? Are people given a choice at all?
Well, right now, it's been relatively simple in Lincoln because we've only been receiving Pfizer vaccine. But we've been working on, as I said, we just received our Johnson & Johnson doses today. And we're working on how we'll be able to work with those in our essential infrastructure group. So it's quite likely that that'll be available to our educators and there are other groups that may benefit from that, such as our homebound individuals. So we're just working through the process right now, Riley. But the biggest thing is, if you're offered a vaccine, the most important thing is to take the vaccine that's offered.
A follow-up question. How long do you think or project that the vaccines for the educator population group will take?
Well, we have over 20,000 individuals to vaccinate, and since we've only been allocated 10% of our current doses until we get to the 65 and under, and I think it'll be a few more weeks before we get to through that age group to those 64 and younger. It probably will take some time depending on how much vaccine we receive. And if you remember what the governor's recommending we do once we get through the 65 and older, is that we then switch to 90% of the vaccine going to those and those other infrastructure areas, of which educators are a group in there.
Hi, Director Lopez. This is Bill with 1011. We have heard from a few viewers about confusion between registering on the state's website versus the county's website, and some people who have registered on the state's website and not the county's that then did not get a phone call and were only able to register because they called back into you guys to double check what the problem was. Have you seen any issues like that?
No, we've been receiving downloads from the state system on a regular basis so that we can update our system. I will tell you, Bill, I personally had some phone calls or emails from people who felt like we hadn't contacted them yet, but they were individuals that were 65 or 67, and that's not the current group that we're vaccinating. So, but I appreciate you sharing that information, and we'll double check and make sure that something isn't amiss. Anything else today?
Director Lopez Riley with Journal Star. You talked about the 3,000 doses of Johnson & Johnson in the state receiving about 15,000. Do you expect that number is what or percentage is what Lancaster County will receive in the coming weeks, or do you expect more? And where do you think dose allocations will trend for Lancaster County? Do you expect that we'll receive more based on our population?
I do know that originally the state requested the 15,000 doses, and we received those today. And we were told by the state this morning that they will not be able to request any more doses till March 23rd. Now, whether that means they'll get more doses, on March 23rd during that week, or if they'll make a request and then get more doses. We anticipate it will continue to be allocated as they have been allocating vaccine based on a population basis.
Director, this is Brent with Channel 8. I've seen some national reports that say there's a growing number of people not returning to get their second doses. I know the governor said a few weeks ago there was about 6,000 people in Nebraska who hadn't. Have you seen that here in Lancaster County, or is everyone showing up so far to get their second dose?
Brent, that's an easy question to answer for me. People are showing up to get their second doses. We're extremely pleased how well that has been going. And if for some reason somebody becomes ill or they have a life event in their family and they're not able to get that second dose when it was scheduled, they reach out and let us know so that we can accommodate them. So, as we said, since we started receiving vaccine, people in our community want the vaccine, and I'm really pleased about that, and I want that to continue, because the sooner we can get the vaccine into the arms of people, the more quickly our community can move forward safely.
So far batting 1,000 or pretty close to it?
Yes, but I do know in other health districts that's not the experience that they've been having.
Director Lopez, I have a COVID risk dial question as it relates to vaccines. Will the risk dial consider the percentage of vaccinated population as it relates to, easing or moving into the green? Is that one of the things that your staff will be considering in that calculation?
Riley, I can't answer that right now. That is a discussion that we have been having, and that we're continually monitoring what the information is out there from the scientists who are looking at research about what level of vaccine you need to have. So we're going to continue to monitor that, and we'll update you as our discussion as we learn and gain more information.
Director Lopez, we have a question from KFOR. It says the guidelines say that the second dose is supposed to be 3 weeks after the first. How wide is that window actually, and is it less effective if you wait 4 weeks, for example?
No, their CDC says, and I won't be able to quote it exactly, but we follow that guidance, that there's a 4 to 6 week window to get the vaccine that will remain effective.
Director Lopez, another vaccine sort of related question. Obviously, the arrival of the Johnson & Johnson means that more people are going to get vaccinated sooner. Do you have any concerns that the social distancing practices employed at businesses controlled by the directed health measure, the social distancing at restaurants and whatnot, it might lapse as people become more comfortable with vaccine arrival? And have you seen any fall off or slippage?
We haven't seen changes, and we continue to monitor, but Riley, I think that was one of the things I was really trying to emphasize, and I think it's really important for people to understand that right now, especially with the appearance of variants in our community, we really need to continue to follow those measures that we've been doing. We know in Lincoln that it's made a tremendous difference in the number of cases that we've had and the number of deaths that we've seen. And I think it's really important that we continue to follow those measures of wearing our mask, keeping that distance, and washing our hands. So we're going to keep emphasizing that, and I think you hear the governor emphasizing that at all his news briefings. It's just really critical at this time with the appearance of the variants that we do that, even though it's very exciting that we have vaccine, and I'm looking forward to us having even more vaccine, and we're prepared for when that happens.
Director Lopez, this is Bill from 1011. Kind of related to that, is there a certain threshold that we would need to hit to ease back on that mask mandate, as we have seen some other communities in Nebraska start to do so?
Bill, we're not looking at a threshold for the mask mandate in terms of vaccine. We're looking at in the number of our cases and our positivity rate. And I want to give you an example. In Grand Island, they eased back from the mask mandate. They currently are having another outbreak in their meatpacking plant right now, where over 44 individuals are now infected with COVID. And that has carried out into the community again, much like the first time this happened. So I think is a really important example of why the mask mandate, why the masks make a difference, why washing your hands and keeping your distance, and why we need to stay in tune with that until we get further along in getting more people vaccinated.
Unrelated question. We're about 2 months from the spring game right now. Are there ongoing conversations with the university about whether we'll have fans?
Yes, there are, Bill, and we'll probably have some information to share in a couple weeks. We're meeting with the athletic department on a weekly basis.
We have another question from KFOR. It says the City Council has scheduled a March 15th public hearing and vote on ending the declared COVID-19 emergency. Do you think doing so is a good idea, or would ending the emergency be premature in your opinion?
Well, I think that our city attorney clarified in Jim David's favor about why the emergency is in effect and what the purpose of the mayor's emergency order is. And we also have that same order from our county and what that allows us as a community to access to meet the needs that we have. The pandemic is different. It's a public health emergency. It's not the same as an emergency when we have a flood or a tornado. And Jim Davidsaver illustrated that yesterday when he was talking about when you have a tornado, which I've worked, and floods, which I've also worked in my public health career, you go in, you assess what's happening in the area, you call in, and you deal with those. This pandemic is a much different thing. We move from one case to another. We're still not in that, if you want to call it, recovery mode quite yet. Thank you.
Are there any further questions? If not, in closing, we just want to encourage everyone to get vaccinated as soon as you are eligible. In clinical trials, all 3 vaccines we will be administering, Moderna, Pfizer, and Johnson & Johnson, are virtually 100% effective against hospitalizations and death. So help protect lives and livelihoods by taking the first vaccine available to you. The first step in the process is to get registered to be notified when your turn comes. Lincoln and Lancaster County residents may register through this secure online form, available in both English and Spanish, as Director Lopez mentioned, at our website, covid19.lincoln.ne.gov. And those who don't have online access or who may need assistance can call the Health Department's hotline at 402-441-8006 to register. And by getting vaccinated and taking the smart steps that Director Lopez outlined to protect one another, wearing our masks, washing our hands, and watching our distance, we will beat this virus together. Thank you.